Hello and welcome. This is the MSP Voice webinar series. Today, I am pleased to be joined by J. David Sims with HIPAA for MSPs. David's going to go through what they have to offer in terms of helping you get HIPAA compliant. I'm really looking forward to seeing this and having some interaction. David, why don't you give us a brief introduction about yourself?
Sure. Well, the next slide actually goes into that, but I'll jump
Okay.
ahead. I'll jump ahead a little bit. As a matter of fact, I'll go ahead and switch to that. So today we're going to be talking a little bit about duct tape HIPAA, and we'll get into what that actually means. But that's me. Hey, I'm the guy. We'll go through a lot about HIPAA compliance and all that. It's definitely not going to be a sales presentation where I'm going to try to sell you on my service. We'll get to an offering later at the end, but I definitely want to leave some value for those who are attending and those who are watching later. But for me, I have a big family. I have 4 kids, and I have another that's a stepson. So all 4 are boys. Currently, 3 of those are serving in the United States Air Force. So super proud of all those. Husband, MSP. A lot of people don't realize this, but that is my day job. I run an MSP out of the Charlotte, North Carolina market. So I'm not just a guy out here spouting this stuff. I'm living it day to day. I run HIPAA4MSPs.com, which is what we'll talk about today. I'm a podcaster for helpmewithhipaa.com. You can catch that free podcast, as they all are. Also, industry subject matter expert and public speaker. So that is me.
Great. I don't know if that was on a slide. We're still on the first slide here on the
We're
on the
still on the first
presentation.
slide.
Yes, we are.
Okay. Let me see. Let me click that. How's that?
There we go.
Okay.
That guy.
Not that you needed to see all that anyway.
Well, it's nice to put a face to the name. So,
Yep. So go ahead and kind of give everybody a little warning. Woke up a little under weather today, so I'm hoping to not clear my throat too much. I may mute the microphone real quick or something like that. But we're gonna have some fun, man. HIPAA's awesome to talk
okay.
about.
Yeah. I'm in the same boat in the cold, so don't worry.
Good, good. But Doug, if whenever you want me to start, I'll start. You
Yeah,
can
go
feel free
ahead.
to interrupt
Yeah,
me at any time with questions, and we'll just go down the path of learning some things about HIPAA.
great. I'm like I said, I'm excited. Let's go ahead and get going here.
All right, let's roll. So duct tape HIPAA. So most people think when you hear like duct tape marketing, it's kind of a cool term. It's like, hey, I'm able to market on the cheap. Well, duct tape HIPAA is kind of doing compliance on the cheap, but it's not a positive term. It's actually fairly negative. I came up with this term. I gave it a definition, and my definition is basically when you're trying to address federal regulatory responsibilities using quick and easy methods and solutions, but you incorrectly assume that that's going to fix the problem. Not only is it a bad business practice, but you could be violating federal regulations. You could have massive liabilities, and it may even be illegal.
And
So you certainly
that's
don't want to do that.
yeah, especially if you're an MSP and they've trusted you to make sure that they're HIPAA compliant. So there's definitely a lot of liability there.
Absolutely. And when you look at, if I were to ask you, are you running a duct tape business? I mean, most of you are going to say no, but let's take a look at a few examples of what that might look like. So let's say you're running a body shop and you're doing duct tape body work. That might be what your business looks like. Or let's say you're running a tire repair shop. Maybe it looks like that. Uh,
Nice.
or maybe you're a moving company, which also looks like they went to the body shop apparently. Or lastly, what if you were a plumber? You're doing duct tape plumbing. So that's what that would look like. So all that to be said is that it's not where you want to be, and it is all funny until you realize that, truth be told, we're the guilty party. We're looking in the mirror and we're actually seeing ourselves doing these things incorrectly. As a MSP community, a lot of this stuff is being done incorrectly. Back in 2016, there was a settlement that came out, and settlements come out rather slowly. So something that may happen this year, it might be a couple of years before you actually see a settlement come out of this. But back in 2016, a settlement came out. There was a Catholic Healthcare Services. They provided management as well as IT services to 6 skilled nursing facilities. And what happened with them is that somebody lost a cell phone. So as a business associate, somebody lost a cell phone. There was a breach of around 412 records that were contained on that cell phone. They were charged $650,000 because that cell phone was lost and had to go through what's called a 2-year corrective action plan, or a CAP. So that's basically where the government's all up in your business, making sure you're addressing HIPAA properly for 2 years, which I can assure you will run into the hundreds of thousands of dollars to have to address all the things they're going to find because they're in your business for a couple of years. So
Wow,
that's just
all that from a lost cell phone.
all that from a lost cell phone. And one thing that I hear MSPs sometimes say is, well, what if I don't have PHI? Well, you may not, but maybe you do, and that's part of what you need to do when you start doing your risk analysis and your risk assessment, is figuring out how that stuff comes into your business and goes out. If you're handling backups for your covered entity or business associate clients, then you may hold some liability. If you're bringing systems back to your business to work on and they have PHI on them, then now you have that in your possession, and so you have now changed the way that you have to do business with these people, and it can get you in a lot of trouble. So let's take a look at a couple of case studies, and these are not case studies of things that are happening, but what I want you to do is think about what would you do and how would you handle it. So case study number one. You have a medical office client, and they call you and tell you their computers have a message pops up on their screen, their files are encrypted, and they have to pay money in order to unlock the files. Now, you and I, and probably everybody on the call, knows this as what? A ransomware attack.
Yeah,
right?
ransomware. Yep.
All right. So now you have a ransomware attack. So what are you going to do? As their IT provider, what are you going to do? Well, the most common question, or the most common answer rather, is, well, I'm going to restore from backups, or I'm going to just nuke and pave because the client is, on top of me to get their systems back up and running. Are you going to pay it, not going to pay it, whatever? All those questions start coming up. But what are you going to do? You can't just address this like you would a typical client, because there are HIPAA regulations and guidelines they have to go by. We know that we have to first say, well, what does your policy and procedure say that you're going to do when this happens? And typically your client's going to look at you and go, oh, what policy and procedure? But if they have one, which they should, but if they don't have one, that's another thing to address. But if they have one, you have to go by what they said they're going to do. How are they going to actually address this when it comes up? Because the HIPAA security rule requires covered entities and business associates to implement those policies and procedures that can assist them in responding to these things and how they're going to recover from them. So what are they going to do about recovering from their backups? Or maybe they have to institute a business continuity plan. We've seen cases where hospitals have been down for days and sometimes weeks. That's more than just recovering from a backup. That's how are we going to do business if we can't get into our systems? What are your response procedures? What about reporting the incident? Does it have to be reported? Who does it need to be reported to? What if it's actually a breach? How are you going to respond to that? And there is some confusion around what to do when a ransomware attack happens, as far as, is it considered a breach? Is it not considered a breach? And the answer to that is, it is a fact-specific determination. In other words, that's the easy way of saying maybe it is, maybe it's not.
Okay.
But what you have to do is you have to then take the incident, and it is by default, it is going to be considered a breach unless the covered entity or business associate can demonstrate that there is a low probability that PHI has been compromised. And you have to do that based on what's called a 4-factor breach assessment, which we don't necessarily have to go into. But the point is, they have to be able to prove that data was not breached. And if you can't prove it, then by default, it would be considered a breach. And then all the breach notification things kick in. So it's very important as an MSP, you don't rush in to save the day, nuke and pave everything, and now you've lost all ability to be able to get forensics involved to find out whether or not that was actually a breach or just a security incident.
Yeah, because I was wondering about that, because you kind of think, hey, if the ransomware got in there, then that would be a breach. But I guess depending on how the ransomware got there, if they just clicked a link and it downloaded something and encrypted the files, that might be different than if someone was actively trying to attack and planted it themselves.
That's correct. And so you
Yeah.
have, let's say you had a attack that happened and it only encrypted, all the Office files. So, Word and Excel and all that. There's a chance maybe that they didn't get anything with PHI on it. However,
Mhm.
we also know, at least I do from my experience, that a lot of times your medical offices have PHI on those Word documents and Excel files and Adobe scans and all this kind of stuff on their machines. So it's a high likelihood they're gonna have a breach, but if we can prove they didn't, we can avoid a whole lot of problems.
Okay.
All right, so then move to case number 2. So case number 2, you have a client that calls, they tell you that they need to send out some emails to their patients and they want to know how they can do this and not violate HIPAA. Well, first of all, I would say that typically what they do is send out the email and then call you and ask you if they screwed up. But let's say they do. Let's say they're proactive and they're a great client and they ask you that. So what you have to do at that point is you got to ask questions. You got to ask questions like, well, what type of email are you trying to send them? Is it like a reminder? Do they have an appointment, or is it marketing type email? Do you have their authorization to send them an email? Are you using some kind of email marketing platform like MailChimp? Or, are you using an email marketing company?
Mm-hmm.
And if so, are you giving them that data, that PHI to send to your clients? How are you planning to send the email? You're going to use, are you using your Gmail account or are you using some other account to send that email? Who has access to that mail? And this is where a lot of this comes back to, do you have what's called a patient portal, which a lot of entities have these now, where it's built into their electronic medical records platform so that they can communicate with patients within that portal, so that email and messages are not jumping back and forth over, standard messaging protocol. It's going through that platform.
Mm-hmm.
And so that might be the way to do it. But the bigger thing to understand here is that you can't just say, well, send it encrypted. Yeah, that might be the answer. Send it, email it encrypted, but it may not be. It may be things they actually can send out if they have the proper authorization. But just to understand that if they're going to send out some kind of marketing message to 100 different patients, and it's not going to violate anything with HIPAA, and they have the authorization to do it, then certainly you don't want to send a marketing message out encrypted where they have to, go and jump through all these hoops to see it. So
Yeah. Well, but I had a doctor a couple of years ago, and I asked them to email, and they're like, "We don't email. We can't email." So they just said, "No, we're not even going to bother with it. We don't email at all." So I'm like,
yeah,
"Well, that's really frustrating."
yeah, and it's, I mean, they can say that. The problem they usually what they usually say is, we can't do that because of HIPAA, and that's not necessarily the case. It's not that they can't do it because of HIPAA. It's because they don't want to go through trying to decide whether they can do it, can't do it. Is it going to be a problem? It's just easier to say, no, we don't do it.
Yeah.
But they absolutely can. That's like if I go to my doctor and I say, look, I want you to email me all my medical records. Well, I mean, they can send them to me. If I've given them permission to do it, they don't even have to send them encrypted, even though I wouldn't suggest them not do that, but they don't have to, because I've given them permission to send them to me in a manner that is not secure.
Okay.
So interesting tidbit. All right. So
Yeah.
number 3, this is our last case study here. Well, let's say you have a client and they have all this equipment, and they call you up and say, look, you just replaced all of our equipment. We want to donate all this old stuff. We want to take it to Goodwill. What do you do? Well, I've had this actually happen to me, and unfortunately it was one of those calls after the fact. We donated all of our equipment, and I'm freaking out at that point. Because please tell me you pulled the hard drives out. Well, no, we didn't do anything. We just boxed them up and sent them over. All right, so now we got a bad thing to deal with. So, but if they call you up, what you should do is you have to make the information on the drives unrecoverable. And whether or not you decide to snatch the drives out, which is what we do, we just take them out and we physically destroy the drives. You can do other things that erases all the data on it so that it can't be recovered, and they can keep that if they want to. But it's a lot easier to just take the drive out. They could donate the machine without the hard drive, but you need to know how you're going to do that. And then also, they should also have a policy around that. So if they do have a policy and a procedure around it, it's also great to follow whatever their policy procedure is. Because if they say, we're going to take these things out and we're going to pay a company to shred them, and then we're going to get a document back that proves that, then guess what? You need to do that. You need to do that for them so that you can have them following their own policy and procedure, because they can get in trouble even though they disposed of it properly because they didn't follow their policy and procedure. That can still snag them should something come up. So the point here is this: you have to know what your clients as well as yourself are expected to do. Otherwise, you can't help them. So you have to follow their policies and procedures. You have to know what they are. You have to make sure that you're lessening your liability in order to do that. Any questions so far?
Well, actually, someone says, would encryption help? That is, shouldn't it be considered a breach? Or encryption doesn't help when the file is opened and decrypted, or it's still a breach even encrypted? If the data itself is encrypted before the breach.
Okay, so we know that if your drive is encrypted, so you have full disk encryption going on, if somebody's able to enter that machine as it's in use, that data is not in an encrypted state. It is in an unencrypted state. So if I remove that data while it's unencrypted, then it's going to still be unencrypted at that point. So it's not going to do you any good. Now, if you're doing encrypted email, then it's a different ball game. But the encryption point that really helps you is that when that drive is encrypted, and let's say you lose a laptop and it's off and all that good stuff or whatever, you lose the laptop, well, it's encrypted. You can now claim safe harbor exemption because the chances of somebody getting into that encrypted drive are slim because you have it encrypted, and they have to break that encryption and get in it. So it's a different ball game whether it's in use and unencrypted or if it's not in use and encrypted.
Okay, and then let's see. What if your client doesn't put a priority focus on their compliancy? This person, I've stressed importance, but they wave it away like it won't come back on them, especially in the case of physical or positions close to retirement.
Yep. I had this. Matter of fact, the client that I had that donated his stuff was retiring. So yes, you will have people, and I call this the HIPAA schmippa clients, right? They're not interested in doing HIPAA. The question may be, you can, whoever asked it can tell me if I'm answering it correctly for them. The question usually is, what am I supposed to do with that client, and am I liable for that? The answer to that is you are not liable for your client's compliance stance, but you are liable for the services you provide that have to still maintain HIPAA compliance. So you still have to protect the confidentiality, integrity, and availability of that protected health information, regardless of whether or not your client is going to do the right thing or not.
Okay. That answers the question. Thank you. So
great, perfect. All right, so let's do some true and false. Fact or myth here. See if you can get these right, Doug. I'm gonna put you on the spot.
Okay.
So an IT provider of a HIPAA covered entity, and this also could be a business associate. So, but you're the IT provider, and are you required to complete your own risk assessment and develop specific policies and procedures that address HIPAA requirements?
I would say you are.
That would be correct. Good job. So that is a fact. If you are doing business for a HIPAA covered entity or another business associate, because it's not always about medical, you could have an attorney that's a business associate. You could have an accounting firm that's a business associate. You can have an insurance agency that's a business associate. So it's far reaching. But if they're a business associate or a covered entity under HIPAA, and you're providing IT services that either creates, maintains, receives, or transmits that protected health information, then you are considered a business associate by definition, and therefore HIPAA applies to you, and you got a lot of work to do.
Yeah.
So it's not just that you're providing IT services, it's that you're providing IT services that do one of those four things. You're either creating, maintaining, receiving, or transmitting. So in the case of doing backups, since we're talking Cloudberry today, in the case of doing backups, you're moving data. So you're transmitting data from your client to a backup service. Even though you're not touching it, even though it's going from your client to a third party and you're not really in the middle other than the billing part of it, you're still liable for that. And it still puts you in a position where you have to address HIPAA.
Okay. Good to know.
Yep. All right. Number 2. So you're on a roll. An IT provider of a HIPAA covered entity is required to become HIPAA certified and use HIPAA certified solutions for services such as data backup. True or false?
I'm probably going to say true on this one.
Okay, so this is kind of a one that gets people. There
Yeah.
actually is no such animal as HIPAA certified. It does
Oh,
not
okay.
exist. The
Trick
government, the government does not recognize anyone's HIPAA certification, and there are bunches of them out there. Everybody can create their own. And I mean, even within my membership site, we have a certification, but it's not HIPAA certified. But we do have a certification. And if you look around, though, you will see some people who say HIPAA certified. There is no such animal. It is only something that they've created, and it is not something that is recognized by the government. So, be careful. Usually when I see that, I am immediately, red flags.
Yeah. Now, and I understand there is no certification, but what about HIPAA compliant? Is that a different animal?
HIPAA compliant is a different animal. The thing you have to realize about HIPAA compliance, so somebody says we're HIPAA compliant. HIPAA compliance can be attained and lost in the same day.
Okay.
Because it's not a goal that you're trying to get to. It's like, okay, if I'm trying to lose weight, or if I'm trying to hit some kind of fitness goal, once I get there, I can claim that I'm there. But if I go out that very same afternoon and I start overeating again, and I quit working out or whatever, I'm going to quickly lose it, because I have to maintain it once I get there. And HIPAA compliance is the same way. Once you get there, and some people never get there, whatever that is, you might be 90% there or 95% there, but sometimes it's difficult to say we are all the way there, because sometimes it's a moving target, and sometimes it means you have to constantly maintain whatever this compliance level is. It's a lot easier for us as IT people, because typically we try not to get involved with actually having that protected health information. But for our clients, it's a tough game to play to stay, HIPAA compliant. If I have a client that says we're HIPAA compliant, we're doing everything right, and then that same afternoon their office manager sends out emails to all the wrong people with patient information in there, can I now still say that we're HIPAA compliant?
Probably not.
No, I mean you're not. So you have to be very careful. The main thing is just to understand what it means. When I understand when somebody says we're HIPAA compliant, I understand what you mean. But I also understand that that's not something that is it's more of a marketing term than anything, I believe. All right, we have a question.
Yeah, so we've got a good one here. So, can you use a cloud vendor that doesn't provide a BAA like Cloudberry if they say that they have no access to the data since the data is encrypted, or does every vendor need to provide a BAA, particularly if the encryption key is entered into the program that the vendor has control over?
Okay, that's a great question. That is there you go. That's one of those fact-specific determinations, and unfortunately, you hear that term a lot, because it really does get down to the nitty-gritty of what exactly is each vendor doing. In the case of Cloudberry, and we use Cloudberry, so big shout out. Use it for a long time. Cloudberry doesn't store the data, so Cloudberry just it provides the front end piece that encrypts everything, grabs it all, and then it's stored for us. It's stored on Google. It can be stored on AWS, which we've done that before as well. So I have my business associate agreement with Google, because that's where the data is, and that's who touches the data. Cloudberry is just a piece of software, so there's no data going back to Cloudberry or anything like that. So in that case, I don't really have to worry about it. Now, in other cases, like let's say I'm using Datto. In that case, Datto does take the data from their devices and they transmit it to their storage. So in that case, I have to have a business associate agreement with Datto. The fact that a vendor cannot or does not look at the PHI has nothing to do with the fact that they still have some access to it. In other words, if it's sitting in their data center, can somebody go and do something to that box where that data sits? Whether they take a sledgehammer to it or whether they try to hack into it, whatever the case might be, they are still maintaining that data in some form or fashion. So because of that, they still fall under HIPAA. And if they won't sign a business associate agreement with you, then don't do business with them.
Got it. Okay, that was the last question for now.
All right, great. So we'll move on. We have two more. So you're 1 and 1. Let's get this one going. True or false? An IT provider of a HIPAA covered entity is required to implement a security awareness and training program for all members of its workforce.
Well, see, you got me on the last one. It was kind of a trick question. And I know it's only 50-50, but I am going to say yes, you are supposed to do this security awareness.
That is correct. That is correct. So not only, we love to go out there as their vendors, their IT provider. We love to go out there saying, look, you need our security awareness training and we can do this, we can do that. But what we're often not doing is realizing that we have to have that stuff as well. We have to have the security awareness training. We have to have a training program in place, not just, hey, we're watching a webinar or we're doing this. We have to have a training program in place. We have to document the training, who's attending the training, what the training is about and all that. All this stuff about HIPAA is about documentation, because if you can't prove any of this stuff, it didn't happen. And, somebody comes up and there's let's say a case happens where we have a breach and we don't find out about it for a year. Well, when OCR HHS comes in, they could say, I need to see all of your documentation for the last 3 years. Well, holy cow. I hope I have it, right? I hope I have all my risk assessment information. I hope I have all my documentation showing all this training that I've been doing. Otherwise, if I don't have it, then, you certainly can't say, well, just take my word for it. We've been doing it. So good job. You're up on that one. And then the last one here is, let's say you're an IT provider of a HIPAA covered entity. Must you charge the client the same amount of money you're charging everybody else? Because if you charge them more, it is a discriminatory practice and is protected by the Office of Civil Rights.
Oh, see, now, having done business with governments in the past, there is a requirement that you can't sell it to anyone cheaper than you sell it to the government. So I'm going to say yes, that you can't charge your HIPAA client more.
That would be a myth. That would be false.
Oh, okay. So you can charge them more. Okay.
You can charge. Not only can you charge them more, but you should charge them more. Right?
Okay.
And we'll talk about that more in a little bit. But yes, you can charge them more. They're no different than any other client as far as charging. If you want to charge based on complexity, because we have clients that have nothing to do with compliance, but because they're more complex of a client, we charge them more. Same thing here. They're more complex of a client because you're now dealing with regulatory compliance and you're taking on additional liability. We have to carry special insurance because of these people.
Okay.
And so they're costing us more money to provide the same amount of services. Therefore, we do charge them more money because of that. So yes, you can charge them more money and you should be charging them more money.
Well, that's good to know. Okay.
So all this to say, you must be a HIPAA compliant IT provider to legally do business with a HIPAA covered entity or business associate. And one other thing about the business associate agreement, I've heard some people say, well, if you don't sign the business associate agreement, then you're not putting yourself in harm's way. You're not taking on the liability. That is false. Whether you sign that business associate agreement or not does not absolve you from that regulatory duty or the liability. They can still come after you. In fact, having that piece of paper in place protects you because it spells out what you're going to do to protect the PHI, and it also spells out what your client's going to do, and it gives you some wiggle room about certain things like the notification time frame and whether or not you're going to pay for certain things or not. So it's definitely something you want to have in place.
Okay.
The other thing I got here is don't lie about being compliant. Look, if you're not there yet, then just tell, if you got a client or a prospect, tell them, look, we're working on that. Chances are they are too. I have rarely ran into a client or a prospect who has all their ducks in a row when it comes to compliance. So just tell them that. Funny side story. I had back in 2012 when I was starting to learn all this stuff, I kind of got proud of myself. I was learning all these acronyms that I didn't know before. And I was learning what HIPAA was, and of course I could spell it properly, which most people couldn't at the time. And I knew what meaningful use was, and all this stuff was going on. So I go into a prospect and I'm talking to them, and I'm telling them how I can address their HIPAA, and I can address meaningful use for them, and all this stuff. And then they say, well, that's great. You should be able to also help us with our HL7 and our HIPAA 1500 too, right? And I'm like, yeah, I can do that. And little did I know, I found out later. By the way, I didn't win the client, because what they did is they baited me into saying I didn't know what the crap I was talking about.
Oh, okay.
Because HL7 and HIPAA 1500 is nothing that I can deal with. I can't do anything for them. But so they caught me. They caught me because I was, just trying to oversell myself. So don't do that. Just tell them, say, look, that's a great question. I'll look into that and get back to you. But don't lie about it.
Got it.
All right. And let me show you this. This is kind of funny in a way. People say, I hear this a lot, MSPs, sometimes even people that are in the compliance world, we know HIPAA, we understand HIPAA, up one side and down the other. All right. Mm-hmm. I did this chart to kind of break down what HIPAA looks like. So at the top, we have HIPAA. HIPAA is broken down into two titles. So on the one side, we have, the healthcare access, portability, and all that. On the other side, we have Title II, which is preventing healthcare fraud and abuse. And though that's the area, Title II is where we kind of start getting into what we deal with. So up under Title II, we have things broken down into the privacy rule, which most people have heard of, transactions and code set standards, which MSPs probably don't deal with ever. And then we have the security rule, and everybody loves talking about the security rule within the IT industry. But even beyond the security rule is broken down into three safeguard areas. We have physical safeguards, which you may or may not deal with. It's things like physically protecting the data. So this could also mean paper records. What are you doing to physically protect your paper files, places where you're keeping things locked up, or just flipping papers over upside down so people can't read information on it. So those are types of physical safeguards. Then we have administrative safeguards. So we're getting down into the paperwork and the policies and procedures. And then we're in the world we live in, the technical safeguards. So we love the technical safeguards because we understand all the technical jargon and all the things we need to put into place to make these things happen. But when you walk into a client and you say, we understand HIPAA, understand the chances are you don't understand HIPAA. You understand the technical safeguards of HIPAA. You might understand a little bit of the privacy rule. You may even understand some of the other safeguards, but you don't really understand HIPAA as a whole. And as long as you can understand that, you also can more accurately tell people what it is you're doing for them. Because if you're coming in and you're saying we can help you with your HIPAA compliance, you can help them with a portion of that, but you are not the person coming in and addressing all these other areas that they have to deal with. So any questions on that?
I don't think so.
Okay.
There was some clarification in terms of the reference to the last question. If a CSP stores only encrypted EPHI and does not have decryption key, is it HIPAA business associate? Yes, because the CSPC receives and maintains, e.g. to process and or store electronic protected health information for a covered entity or other business associate. Lacking an encryption key for the encrypted data it receives and maintains does not exempt CSP from business associate status and associated obligations under the HIPAA rules.
That is correct.
An entity that maintains EPH on behalf of a covered entity or other business associate is a business associate, even if it cannot actually view the EPHI.
Yep, that is correct. Yep.
And so that's what you're talking about before, like Amazon or Google as the business associate, in terms of backup. Right? Mm-hmm. They can't see the data, but they still have it. So, you need to have a business. Need to have a BAA with them.
That's correct.
Okay.
Yep. So it has nothing to do with you can't see it. I've heard MSPs say that before. I can't see the data. Why am I a business associate? I can't touch it, can't see it. I can't open it if I wanted to. That has nothing to do with it. Because you have physical access to it, or you have some type of persistent access to it. Maybe
Hmm.
it's that you have logged me in on the server. Well, you have a persistent access to that data. Whether you use it or not, or you see it or not, has nothing to do with it. It's because you have persistent access makes you a business associate.
Got it.
All right. So let's check out this little quick reference chart here. One question I get from MSPs a lot is, what is it that I can provide to my clients that they actually need or are required to have? So here's a list I put together what some of these are, and we'll run through these really quick. So you have a security management process. So this is where they have to implement policies and procedures to prevent, detect, contain, and correct security violations, which is this is where MSPs live, right? We're preventing security violations. We're trying to detect them, contain them, correct them. This is, everything we do pretty much is in this one thing.
Hmm.
And then we go down the list. We have security awareness and training. This is something that's getting bigger and bigger, that MSPs are providing security training through, sometimes they're doing it in-house, sometimes they're doing it through outsourcing to third-party training companies and things like that. But this is also something that you can provide. Password management, contingency planning, data backup planning, workstation use, device and media controls, disposal of how you're going to dispose of that stuff. We talked about that a little bit. Data backup and storage. They have to be able to create and retrieve exact copies of their data. And I hear a lot of MSPs tell me that they are not actually testing the recoverability or the retrievability of their data. And that's what clients are paying for. They're not really paying you for backup. They're paying you for the recovery of that backup, right?
Yeah.
If they're not getting the recovery part when they need it, they're not paying for the backup.
Backup, you treat it as an insurance policy. You hope you never need it, but when you do, you need it to be there, right? So it's essentially an insurance policy that in case you ever do something bad happens, that you'll be able to get that back.
Yep. And the longer you're in the IT world, you'll eventually have somebody whose data is not able to be recovered, and they were paying for backup.
Mm-hmm. Yep.
So it's, we had a client one time that was using, I won't mention the name, but it was a big backup vendor. And what happened with this guy is he decided he didn't want to pay monthly for it. He wanted the cheaper, I'll pay by the year for my backup. And he set it up. And when he set it up, I don't know what he did, but when he set it up, he thought it was a set it and forget it type thing. We come in 3 years later, and we said, well, I understand you don't want to pay more than $59 a year for your backup, but let me just look at what you have, and then I can give you I can at least give you a price. Well, in looking at what he had, I discovered that it never backed up more than the first day he set it up. So for 3 years, this company had no backups and thought they did.
Oh, jeez.
If you could have seen the look on the face of the business owner. But that goes, it goes back to all these other things about making sure that you're testing the recovery, you're managing things, you're documenting that things are happening. If this person would have been documenting that his backups were happening, then he would have known, a week later, this stuff wasn't happening. Yeah. So the other things, access controls, unique user identification, which is a big problem in almost any industry we go in. Everybody wants to use the same username and password for everybody that works there. Can't do that. And then encryption. We hear a lot about encryption. Encryption is addressable, which means it is not a requirement, but you do have to address how you're going to implement something that will protect that data, if not using encryption. But we are seeing a lot more people use encryption because it's so readily available nowadays than it was before. So why do I talk about MSPs? Because I don't say IT providers a lot. And the reason why is because some of the things your clients have to have are patching, network systems management, and that documentation of all these things that are happening. And this is where MSPs are usually living. They're living in that RMM platform that's doing the patching. They're doing the network management. They're documenting everything. They have all these reports. So that is one reason why being an MSP and doing these things is something that your vendor, or not your vendor, but your clients absolutely need. And we talked a little earlier about the money side of things. So how much can you expect to charge? Well, on average, I would say you could charge anywhere from 30 to 50% higher for the exact same services than what you're charging a non-compliance type client. And then you also have a number of other additional services that they will need or that you can offer them that other clients may not have. So if you want to know how you can increase your revenue or offer a higher charge type business, then compliance certainly is something you can look into.
Yeah, and it just so happens that a lot of doctors' offices, dental offices, those types of things are small businesses themselves. They can't afford an IT staff, right? So it's
Yeah, correct.
because a lot of MSPs I talk to, they specialize in medical, dental, and those types of things, just because there's a high number of doctors' offices in their town that need IT or dental offices. So yeah,
right. Yeah, and even those that do have IT, sometimes they don't have some of the things that they need to deal with in house. They can't have their higher priced $30-$40 an hour technician working on. And so a lot of times you can come in and supplement their services as well. So don't think just because they have IT in house that you can't provide some other services around that.
Good to know.
So this is an interesting concept here. So I often wonder when they say they're an MSP, are they talking about being a minimum service provider? And here's a quote I actually pulled from the ransomware fact sheet that's put out by HHS. It says, the security rule simply establishes the floor or the minimum requirements to address security of the EPHI. And they also say that they encourage providers to implement additional or more stringent security measures above what the security rule standards state. So if we're running out there and we're just saying we have to meet HIPAA, we have to do these things that the security rule says. If you're only meeting those things, you're doing the minimum requirements that are necessary. Now, I can't imagine how this might look from a marketing standpoint. Like, hey, hire us to do the absolute minimum necessary to make sure you're compliant. But MSPs are running around doing that. They don't realize it a lot of the times, but that's what they're doing. And they often don't understand what they're doing because sometimes they're bringing in third-party companies who are saying, look, we'll handle this HIPAA stuff for you. You don't have to worry about it, but you're not learning anything about it. You're not learning what you need to do. And are you sure they're doing anything above just the minimum necessary?
Yeah.
Chances are they may not be. Don't know. But I'm saying you don't want to be a business that's doing the minimum necessary. I would hope not.
Yeah. You want your marketing tagline, we go above and beyond what's required by the regulations.
Right. Yeah.
Yeah.
We'll make sure that we do the minimum necessary to make sure that you're up and running. So all of that to say this, look, just don't be that guy. I mean, really, learn what this stuff's all about, how you can deal with it and address it. And more importantly, how can you improve your margins and make money off of it? And I'll throw a few resources out here for everybody. So HIPAA for MSPs is the resource that I have. The free podcast is helpmewithhipaa.com. You can go there, or you can find it in iTunes, Stitcher, and all those other places. healthit.gov, hhs.gov/HIPAA, HIMSS.org, and NIST.gov. These are all great resources to help you learn more about HIPAA. Some of these are, I think mine's paid. Some of them are free. I think HIMSS has a paid level. But whether you decide to pay for things or not, there are lots of resources out there. It's just a matter of how quickly you want to learn it and learn it properly.
And hopefully all those websites are currently up right now and not down.
That is correct. But that's everything in the presentation. I do want to say that if you want to take advantage of a special offer I have for Cloudberry, this is open until Friday at midnight. Go to HIPAA for MSPs.com/Cloudberry. And if you want to take advantage of that 50% off your first month, you can use coupon code Cloudberry at checkout to get that special offer.
So that would be January 18th?
That would be the 18th of January.
Okay. Yeah. Just in case people are listening to this on replay.
Yeah.
Wow. Great. So just real quick. So, you talk about, what is it that kind of HIPAA for MSPs does offer? I mean, you provided a lot of great information, a lot of good background, but how can you help MSPs to make sure that they're going above and beyond the bare minimum of what's required for HIPAA?
So HIPAA for MSPs is a membership site, and what we focus on is educating that MSP community on what is required of them and what they need to do to address HIPAA for themselves first, and
Okay.
then how to actually turn that into a compliance as a service offering so that they can address what their clients need. Because it's not a matter of going out there and saying, okay, I know what these doctors' offices need. I know what these dental offices need. I'm going to go out there and sell them stuff. That's all well and good, but what are you doing to address compliance within your own organization?
Got
Because
it.
you can't go out there and just do things for somebody else, because when they start having you sign a business associate agreement, whether you sign it or not, you're still saying within that agreement, you're still saying, I am doing the things that I am required to do to meet HIPAA regulation, as well as protecting your data and PHI and all other stuff. So you're standing there saying you're doing these things. You don't want to be caught with your pants down, so to
Yeah.
speak, not addressing this stuff. And you're supposed to be doing it. It's actually illegal to do this without having your own stuff done.
Yeah. So if you're, if you're listening and you're not doing any, you're not working with any HIPAA, required clients today, and you saw that, 30 to 50%, upcharge, this would be a good place to start to make sure that you're HIPAA compliant before you go out there and start to try to track that HIPAA business.
Absolutely. And we've had members that have come in and they start learning this stuff, and they go out either to their current customer base, or they have a new client. A lot of times it'll be a member will join because they'll say, hey, we just had a doctor's office contact us and they want us to give them a quote, and we don't know anything about HIPAA. And I'm like, well, calm down. Don't tell them that you're HIPAA compliant and all that. But you do have a lot of work you need to do, and you need to do it fairly quickly. But
Yeah.
at least you're moving in that direction and getting stuff done. If something happens, I'm not saying you won't hold some liability, and I'm not saying you won't hold some monetary fines. But what I am saying is if that happens, you're going to drastically reduce what that's going to look like by moving toward compliance and getting that done.
Great. Awesome information. I don't see any more questions in the Q&A panel. If anyone does have one, feel free to type it in now. I appreciate you going through all this information here today, David, and also for putting that special offer out there for the listeners. So definitely take advantage of that before midnight on Friday, January 18th, if you're interested.
Yeah, absolutely. And I appreciate you having me on, Doug. It's been fun.
Yeah, it has. Well, great. Well, with that, I think we go ahead and wrap it up. And again, David, thank you, and hope to talk to you again here real soon.
Absolutely. Thanks again.
All right, bye.
Bye.